Hi everyone, my name is Matt Salomon. I'm the Government and Community Relations Manager for the chapter. I just wanted to thank all of our ALS families, donors, advocates, volunteers for supporting the chapter during these crazy times. We know that ALS doesn't stop, and neither will we. We might just be doing it in our pajamas. And with that, I wanted to just share some updates on what we're doing and what's coming up. So there has been a silver lining in this COVID crisis. The Centers for Medicare and Medicaid Services has decided to reverse its decision to include non-invasive ventilators in the competitive bidding process, which means that ALS patients are going to have more access to affordable non-invasive ventilators and respiratory therapists. Now, some of you may know we've been working on the SMART Act to reverse this decision, but that is no longer needed to pass because CMS decided to reverse it themselves. So that is a good silver lining in all this. Just today, our chapter signed a letter to Governor Hogan of Maryland and a letter to Governor Northam of Virginia, encouraging them to adopt anti-discrimination policies during this COVID crisis in order to prevent the rationing of medical care to ALS patients and other disabled people during the crisis. If we come into a situation where a hospital has a surge of patients and they have to triage, there should be no discrimination on the provision of medical services in those scenarios based on somebody's disability status and their perceived value to society. This has happened in other states and other countries before during this crisis. So we're just trying to prevent that, and we want the governors to adopt strict anti-discrimination policies in that regard. Coming up is the ALS Advocacy Day and Public Policy Conference. So we're obviously going to have to do things a little differently this year. We're not meeting on the Hill. We're not meeting at the Marriott for our conference. So this year on May 26th through May 28th, we're going to have 3 days of webinars. They're going to be about 90 minutes each. The first day, the 26th, is going to be a webinar about advocacy. The next day will be research, and the next day will be care services. And then finally on June 3rd, that will be sort of the new Capitol Hill Day. And people will be able to we're going to have a call Congress Day, and people will be able to call Congress from their home, send emails and that sort of thing. So hopefully we'll have an even bigger impact and turnout than our physical Hill Day. So just keep an eye out for that. If you haven't already, please go to alsinfo.org and register as an advocate so you can get information on those events and any other important information that we have to send out regarding ALS advocacy or COVID or any of that. So please go to alsinfo.org and register. I just want to thank you again, and stay safe and sane.